Hello there, you're now with me, Douglas Elliott, for TVS News at 5. Let's begin with our top story. Masquerading behind a vegetable garden, a cannabis farm in Sungai Bidut and SIBU was uncovered by the authorities on Wednesday. The plants, measuring between 2 to 7 feet tall, were grown indoors in a farmhouse. 5 suspects, including 2 women aged between 29 and 59, were detained during the raid. According to Sarawak Deputy Police Commissioner Dr. Mancha Atta, a total of 34 cannabis plants worth over 56,000 ringgit were seized alongside a vehicle worth 40,000 ringgit.
All 5 suspects, including 2 foreigners, have no prior criminal records. They will be remanded until July 30 to assist with the investigation under Section 6B of the Dangerous Drugs Act 1952. Meanwhile, one of the male suspects will be investigated under Section 15, Subsection 1, under the bracket A of the Dangerous Drugs Act 1952 after he tested positive for drug tests. If convicted, the suspects could face life imprisonment and a minimum of 6 strokes of the cane.
Sarawak, Datuk Petinggi Tan Sri Abang Johari Tun Openg is currently in London for an official work trip to the United Kingdom. The visit serves to study the process that will lead to the establishment of Sarawak's very own Sovereign Wealth Fund. Abang Johari led the Sarawak delegation comprising Deputy Premiers Dato' Amar Awang Tengah Ali Hassan and Dato' Sri Dr. Sim Kui Hian.
On Thursday, the delegation met with officials of the International Forum of Sovereign Wealth Funds, IFSWF, and the PricewaterhouseCoopers, PwC. Abang Johari said that Sarawak hoped to learn and gain insights on the best practices and experience of UK sovereign wealth funds investment strategies, management and governance, as well as its legal and policy framework as part of the benchmarking process. As such, he expressed his hope that in this meeting, IFSWF officials would be able to share their experiences and expert knowledge on the operation and governance of such state-owned investment funds. Formed in 2008, IFSWF is a voluntary organization of global sovereign wealth funds that are committed to working together and strengthening the community through dialogue, research, and self-assessment. During the trip, the Premier also met with fund managers of the UK Government Investment Limited (UKGI) to understand policy structures, intervention, and expert advice on the development of sovereign wealth funds. Previously, the Premier had travelled to Norway and Singapore to make similar studies of the models used in these countries, adding that an ordinance would be tabled at Dewan Undangan Negeri, Dun, in November to provide the legal framework for the formation of the fund.
Parti Pesaka Bumiputra Bersatu PBB Vice President Dato' Sri Abdul Karim Rahman Hamzah lauded the historic passing of the Constitutional Amendment Bill 2022 on Thursday, in which he regarded it as a good development towards a better political scene in Malaysia.
It's a good decision, saya melihatnya sebagai satu perkembangan yang baik yang boleh menjurus kepada perjalanan politik yang lebih baik untuk Malaysia.
Karim, who is also the State Minister of Tourism, Creative Industry and Performing Arts, noted that Sarawak does not need to enact its own anti-party hopping bill, seeing that the Election Act is a federal law and not a state law.
Saya rasa perkara macam ini ya tidak perlu di peringkat kalau Parlimen sudah membuatnya, kerana akta pilihan raya adalah akta di peringkat pusat. Kita hanya menunggu bila ia digazet saja untuk menjadi undang-undang yang diguna pakai.
On Thursday, the Dewan Rakyat unanimously passed the constitutional amendments to the anti-party hopping law, which prohibits Member of Parliament to switch parties. The bill secured over 2/3 majority vote, with 209 members of Parliament voted in favour of the bill, while 11 members were absent.
Kuching's recognition as a creative city of gastronomy by UNESCO is a testament to the region's melting pot. State Minister of Tourism, Creative Industry and Performing Arts, Dato Sri Abdul Karim Rahman Hamzah said Sarawak has always been known for its diversity and an exemplary of unity in Malaysia. Therefore, he invites the participation of ASEAN communities to share and promote the cultural diversity in building a better intercultural understanding.
Despite all this diversity, different religion, different culture, we are very, very united in Sarawak. And it was reflected in the last general election that was held last December in the state of Sarawak, where out of 82 seats that are in contention, 76 seats were won by the coalition government or the parties that form the coalition government in the state of Sarawak now. Well, apart from that, Sarawak has got 56 protected areas, 37 gazetted national parks, 5 wildlife sanctuaries and 14 nature reserves. You will be in awe of what we have to offer. Most recently, Kuching has been added to UNESCO Creative Cities Network under the field of gastronomy. This is a testament to the diverse, scrumptious food we have here.
Kecemasan, boleh saya bantu?
Hello, there's been a motorcycle.
Welcome back. Rashes and skin lesions are all the public know about monkeypox. Treatment and prevention are in the medical domain. But the question on everyone's lips right now is, will it reach Sarawak? We have been successful in handling infection in the past, but will monkeypox put a new spanner in the works? We are fortunate to be joined by Dr. Chua Hock Hin today. He is the Sarawak State Infectious Disease Physician. Thank you so much for joining us today, Doctor, on this important discussion. Now, will monkeypox make its ways to Sarawak, and how soon will it be?
So this is a very difficult question, but definitely, as you can see, that monkeypox cases have spread across, I think, 70 nations with about 18,000 cases reported thus far. I think it's just a matter of time before it would reach our country lah. Yeah, I can't predict, but I think everybody need to be prepared to face it because there is always a possibility of coming. The questions of when, nobody knows. We just need to prepare ourselves. Yeah.
Right. Now, the general public, including myself, has an idea of how monkeypox is spread, which is via close contact. But is that the only way of infection, and is the infectivity rate faster than that of COVID-19?
Traditionally, as what I mentioned, monkeypox is transmitted from infected animals to humans and through touching of the animals in contact with the animal's blood, body fluids, as well as the animal skin lesions. So in the current monkeypox cases that we see, the most common transmission is still through close contact. Close contact in a way that there is contact with the skin lesions or bodily fluids of the infected patients. That's why the most common is still through close contact with the skin lesions, all right, and bodily fluids. There has been postulations that possibly monkeypox can be spread through respiratory droplets, meaning a larger droplets, but this has to occur in a very close contact for a period of time. So monkeypox can spread more easily between human to human now through close contact, but we don't think at this moment it is more transmissible than the COVID-19 that we are seeing.
Right. Dr. Chua, you've given us insights about how monkeypox can spread. Now let's talk about treatments and preventive measures. What are the things we should do to prevent infectivity, and what are the treatments like?
The best thing to do at this moment is to prevent yourself from getting monkeypox. That is the most important thing. And second thing is, if you have risk factors for to get monkeypox, when you visit the doctor with symptoms and probably with rash, you have to actually ask the doctor a question: could I be having a monkeypox? All those things, so that the doctor would be alerted as well and would get more information from you. As for now, the incubation period for monkeypox is around, on average, is about 6 to 13 days, but it can range between 5 to 21 days. So the treatment, okay, so far monkeypox that we are seeing now, they are self-limiting, meaning you can have all the symptoms, but after 2 to 4 weeks, in general, it can resolve by itself. But as what I mentioned earlier, there are certain groups of people who are more at higher risk of getting severe infection from the monkeypox. And some of the severe symptoms that can present is they can present with a very severe pain at the anus region, okay, or at the genital region, all right, in which they need to be admitted to the hospital for some painkillers, all right, as well as they can present with severe sore throat, dehydration, that they need to be admitted for hydration purposes, all those things. And because the incubation period is about 21 days, therefore the isolation period recommended would be roughly 21 days at this moment. And in certain guidelines, because monkeypox virus has been found in the semen, therefore the guidelines recommend that the person has to practice safe sex and has to wear condom for at least 8 weeks from the time he was diagnosed to have monkeypox infection. All right.
Thank you so much, Dr. Chua, for joining us on News at 5 on our discussions. Next week, we'll be diving into more topics, and our focus will shift on the recent discussion on MA63's renewal. As usual, you can get the latest news updates both locally and internationally by heading on to our website, TVSTVMY, or follow us on our social media. That's all the time we have for TVS News at 5. I'm Douglas Elliott. Thank you for watching.